in the chat as you go.
Okay, good morning. I hope you all can hear me. Thank you, Dr. Chad, for that. I mean, like before we even start, let me just share my screen up here. Okay, so I mean, we will just do. I won't be too long. I know yesterday's session was quite a lengthy one, but my one won't be that long. But just to give you guys a basic thing of what you can expect in terms of like finance and business. Um, because I do know that you guys as doctors will be venturing into your own business. So
Right, it's a bit
I mean,
softer. It's a bit soft
was my
this
mic
morning.
soft? Okay,
Mm.
I think I need to talk into this thing. Can you hear now?
Yeah, much better.
Okay. Thank you, Dr. Chad. So yeah, before we start, I mean, before I give my intro, let's just go down. Like we can do like a round robin, and we can just say how we feeling from 1 to 10, like each one of us, and just just say what how long you guys have been at doing like doing this whole business thing. How long, like in terms of like your experience, how long have you been doing this? So yeah, I think that would be good. Anyone is free to go. We'll just do a round robin just to, yeah, and find out how everyone is feeling.
I'll start. So I'm feeling at 8 this morning. From a business, yeah, like a Grant. Sometimes the oaks just pop it in the chat. You know, not everyone always wants to kind of speak and so on, which is fine. But I think it's also, yeah, from my side, been about 7 years now in the business sort of realm, I guess, and learning something new every day, even when it comes to, you've got teams of people working on your numbers and your financials and things, but you learn something new every day. So yeah, I think it's something that wasn't fully, uh, well, not at all spoken about in med school. So it's quite a bit of a foreign thing for I think initially when you're starting out. Yeah. So yeah, definitely worthwhile. Anyone else? Oh, Crystal, no, okay, no experience feeling at 8, good. Better than yesterday. Yesterday we were all starting on 4s, so that's good. I'm glad. I think we all struggled a bit yesterday. Anyone else? Amazing. That's good though. Well done. It's good, Bianca. Starting when you don't know much is the best. You figure it out as you go. But the key is just to start. My father always used to say you can't play unless you're on the pitch. You can't score unless you're on the pitch. So yeah, at least. Cool. I think you guys can pop it in the chat as we go. And then I think we can just sort of move into the session, Grant. That's fine.
That's perfect. Okay, so then thank you everyone for those of you that's still going to be checking in and giving your expertise over there. So just a bit about me. I'm Ron Johnson. I'm 31 years old. I have over 9 years experience in financial and project management. I currently serve as the executive director of my own business called GLAX Corporation. And uh, that business is like more chaperone, um, airport airport trips, vehicle rentals, those that in that line. But specifically, it is also service related businesses. So like it's a service related business. So whatever you need, um, like done within business, if it's like tax returns, if it's got to do with COSEC services, which is companies secretarial, which we will cover later on. Those are the type of services that I provide. And I was also the lead project manager for the West East Tourism Precinct here at R Labs, and in these roles, I was responsible for overseeing like project management, developing and implementing project plans, coordinating with teams and stakeholders specifically, managing finances, and also ensuring compliance and regulations to report back to all the key stakeholders that was involved during the with the project during that time. And then in addition, um, I I served as the financial director at Prince of Peace since 2015. So Prince of Peace is another business that was co-founded by myself and my spouse. Um, and it's a online clothing business that we've yeah. So we print positive messaging on those clothing. And yeah, and we have an online store which you guys are welcome to check out as well. Um, and So during my time there, I was managing the financial operations, including the budgeting, expenditure monitoring, and financial reporting. And also my financial experience is further supported by my role at Orlab. So I'm full time at Orlab, and I've owned these skills for like 6 years, working within this working within the finance department within Orlabs, and currently I became a published author with my first fictional novel called King of the Street of Adventure. So that is me in a nutshell. I mean, I just wanted to give you a bit of experience so that you know that whatever I cover, it's not like it's not made up. I do know a bit of what I'm talking about, especially when it comes to business and finance. And I do think it's very important for those of you that wants to actually venture into like having your own business. It is very important um to like at least know the basics because you need to know what's happening in your business. You need to know if your business is making money, those kind of things. So this is just like different forms of business ownerships um that you can venture into, which is the sole proprietorship, especially those that have their own private practice. Those are like one of the forms of business ownerships that you can do. I know that, um, I mean, Chad, you can correct me if I'm wrong, but I know that most of the, the doctors in the medical field, the businesses that they go into naturally is like maybe partnership or limited partnership. I think we're leaning more towards that.
Yeah,
Um,
it's usually
yeah,
it's usually an ink, and that's the primary structure is an ink, but you can have a PTY parallel to it. So I think we discussed yesterday. I said to them, setting up the ink is slightly different to the PTY. You need to first do the PTY, and then you need to apply for an ink, which is just a small caveat with SIPC. But yeah, it's generally in the form of a partnership or ink or independent practice where they operate oftentimes as a sole proprietor too. Yeah.
okay. Thank you for that. Yeah, I do know. I notice a lot of practices would have maybe like um it would be someone's surname and someone's surname. No, okay, maybe there's a joint partnership. Um, but part of the whole compliance thing, there's different uh legal things that gets thrown up in order to protect. I mean the whole partnership, the whole business to ensure that everything runs smoothly. That is no yeah, that is no foul play involved, especially when it comes to um like maybe conflicts on a later stage. But that is generally the basic forms of business ownership that you can venture into. Um, so yeah, there's like one thing. I don't know if um all of your practices are registered, but the important thing to note is it's important that you actually do consider registering your business. Because I yeah the way it will be structured is, I mean, number one, you will be a trusted business, number one. And there will be different regulations and things um that would maybe make sure that you guys are actually operating as an entity, on your own, a trusted entity. Because if you're running a business that's unregistered, um people aren't so trusting towards that, right? So I know that CIPC, they generally the ones that would that's the body that actually registers your business and makes sure that um yeah, that your business get registered by the body. And I think they are part of the department of the government department of trade and industry. um and what you then do is you submit three names for your business to them, and then they would then choose the one that's actually available, that's not clashing with any other business. And they then are responsible for registering your business every year. Like if you should buy a car, and you have to like renew your license this, your business is registered with them. So like every year you need to also make sure that you record like your annual returns to them, in order to still be able to trade under that particular practice name that you opened up with CIPC. Um, they do charge penalties if you don't register. So if you do get registered, this is something that you should consider. Like every year you need to submit annual returns as well to them, in order for your business to be compliant. Because if you don't, after a number of years, um, they would they would send you like emails to say that your business will go into like automatic deregistration. And that is something that you don't want to do, especially if you have maybe investors, or if you want people to invest in your business. And they do their checks, they do their diligence on your business, and they see that, hey, this company they haven't been doing their submitting their returns. They haven't been like making sure that their business is compliant every year. So that is just something very important. The other thing to note is, when you register your business, right? It gets it gets um yeah, it gets registered, but then once it is registered, it becomes a separate entity. Like yeah, it's seen as a separate entity, separate to you, and it will have its own income tax number, which you would then get from SARS. And SARS then, once your business is registered, all of it, SARS will then also follow up according to what your business name is. They would send you a income tax number that's linked to your business. So that's not your income tax number. That would be your business one, once you register that business, right?
Uh, Can I
Is there
just
any
can I just
questions?
add something there?
Yeah.
Can I just add something like that? So I see Tegan is mentioning about Tegan asked a question. So basically, just so you guys understand, so in healthcare, right? So in when you're setting up a structure, so it's called a structure. When you're setting up a structure in the healthcare space, that is a very unique space, right? So we obviously, when you in the business of seeing patients and registering with the Board of Healthcare Funders and all these things, which is what all of us are going to be doing. It's such an interesting thing because if you think about, okay, I'll give you some context. So in one of my businesses, we've got two structures. Okay, so I've got a PTY, which is a limited liability business. So that's a standard company, right, with subsidy, with the directors on it and so on. And then I've got another business, which I'm not on at all, which I've got two doctors on, which is our Inc., right? And in the context of my business, my Inc., which has the my doctors on, that Inc. is the entity that's registered with all the different sort of stakeholders, like the BHF, the Board of Healthcare Funders. That registration over there is what's critical for being registered with the medical aids, right? And then we've got that same entity is registered with some of the various health-related bodies, okay? Also under SIPC, it's got its own tax number, it's got its own, I need to file financials for it, MBA, etc. But the nature of that business, right, is what you as the owner of the business can define. Okay, so in our setting with a company setup, that structure, that Inc., right, operates as, very interestingly, which I'll give you guys the structure. This is a very cool structure, but that entity operates as a locum provider, right? Okay, so there's only doctors that run through there. We don't employ the doctors, they operate as, they operate on their own. But this business supplies doctors to my other business, which ultimately owns my primary healthcare business. I'm talking now specifically of my primary healthcare business. So to your question, Tegan, when it comes to beneficial ownership, I would suggest all of you guys find an accountant that you can sort of just discuss things with, and it's time now to do it, because you're moving into a space where you're going to be independent. And accountants not expensive, don't stress, like they're not necessarily going to cost you hundreds of thousands or thousands even. You just need someone who understands sort of the healthcare space a little bit and can do that. But when it comes to beneficial ownership, my Inc., right, is separate to me completely. It's owned by it's owned by my doctors, actually. So I gave the doctors that business. So all the doctors who work for me or with me, they own that entity 100%, and it provides services to me in my other business. So me as the beneficial owner, this is where it comes in, Tegan. You need to declare beneficial ownership, which means who is the ultimate owner of said business. Okay, so you can have various structures, complicated structures. As you evolve up the ladder, which we showed the other day, you'll see it will get to the point where you need to start thinking of structuring, and not right now. It's not worth it right now. For now, just sort of get going, get moving. But as you evolve in your business and it grows and you get more comfortable, let me see, Christa. Exactly, that's perfect. You register yourself as a PT. I would register in that setting, Christa, because the inks need to have doctors on them. Okay, so that's why it's special. So inks are only for the doctors, and that's the entity that's going to be registered with all the special registration boards and things. So you would have to set up. So what we'll help you guys with, which I said yesterday, was for the ink setup, it's a special process, which you need a bureau for, medical bureau, which we have, where you first set up your own PTY, and then you have to apply to become an ink. Okay, so the ink is sort of the most correct structure for doctors to operate under. So you always see somewhere you go to a practice, will say, like ours is Smith and Partner, right? So then that's one sort of ink with a practice number attached to it, which many doctors can operate under. Or if it's just one doctor, that's your practice number. So that ink model is useful. There's no special benefits to it really. It's just that's the structure that certain organizations want you to operate under. But you can still have another PTY, which is very smart, Christal, that you guys operate as a PTY, because it separates you as a person from the business, and you try to run your life through it. So Tegan, that's kind of what that beneficial declaration means. It's basically who's the ultimate owner of the business that you are kind of operating through. So, for example, I'll give you my structure just for context. So I've got a family holding business, which is my surname, Martinez and Holdings, and that entity then owns into another business called Innovate Holdings, which is my healthcare holding vehicle. And then within Innovate Holdings, there's my healthcare businesses. This Go GP model is in there. The practice buying business is in there, etc. Then you have then on the other side, I've got another entity which is called Luxco Holdings, which has a bunch of other businesses in. So when each business has to be filed, they ask who's the beneficial owner. I then need to declare all the owners, if it's just me or if I've got other shareholders, I need to declare that. It's a new thing, relatively new thing. It never used to be like that. Yeah, so is an Inc. absolutely necessary? It's a good question. It's necessary in the sense that certain, let's call them regulatory bodies, require it to be an Inc. Specifically the BHF, which is the Board of Healthcare Funders. So you get your BHF number and all that stuff. That's the number that allows you to transact with medical aids, should that be something you're going to do, which we are going to do. If you have a PTY, the PTY alone wouldn't necessarily allow that. The irony of everything is, that's the most ironic thing ever, but when you register with a medical aid, right, you can give them the bank account that you want to use. It doesn't even need to be an Inc. You need to submit it. Yes, you need to submit the documentation. You need to submit all these things to be registered. But for us, we've got another business called Primary Care, which is its own business, which is where all the funds flow to, for any money that gets generated. And then Smith and Partner, if you remember, I said that is purely a locum provider to my business. So in that setting, it only receives fees from me for providing the locums. So I basically pay the doctors into that. So it's quite complex. This is very much sort of the IP I've built over the last few years, which I'm obviously happy to share with you guys, and I'm comfortable sharing with you guys because we're building this thing together. But it is important to get your structure right. One of the biggest reasons this is such a big thing for me is because you need to build up equitable things. You need something that's got, that's equitable, that is equity in that. Instead of just selling your time forever and ever, you need to build up something that is actually going to be worth something over time. And that is a function of, structuring quite early on. So the beauty of this model, and obviously building the community, is that it is access, right? So you have access to, all the IP and the knowledge and so on, as this thing evolves. So yeah, I think, Tegan, to answer your question, yes, there are certain structures where it is very much a necessity. But operating as a PTY, I would suggest having a PTY and an Inc. It does add admin costs because you need to file returns for all of them, you need to do all these things for all of them. But it's a useful thing to have in place. But yeah, so like, for example, I've spent a lot of money on structuring, but it's because of kind of where I am at the moment. So initially, I wouldn't worry too much about it. We as clinicians or people operating in the doctor world have to be registered in a certain structure to allow you to more for medical aids. Sorry, Grant, I just wanted to add that in there. But if there's any other questions and things, please pop it in the group. Grant will push through, and then I'll try and sort of respond to the ones that come through on the chat to give some more context and stuff, if that's okay.
Thank you, Chad. That was very helpful. I mean, also just to echo the beneficial ownership thing, I know that they implemented that like before it wasn't really necessary to submit, but now I think since 2023 they made it, or 2022 they made it like a compulsory thing for you to actually submit to CIPC. So it is quite important once you are registered and you have more than one director in the business um to submit that, because then what I basically just wanting in terms of like the security and securities register and all of that, I just want to see how much shares the like each director will have within the business. And if you are like a sole proprietor, one person running one director in your company, I mean it's easy because you will get the 100% share of the business. So, but it is important for you to actually then declare that to CIPC. Um, so yeah, so if there isn't any other questions, then I think we can move on to the next part. Um, so quotation and invoice. Who wants to tell me what the difference between the two is, between a quotation and an invoice? Anyone? Um, so I have a question. So pay do you pay people on a quotation? Like, is it necessary to pay people on a quotation?
I'm just
No.
guessing. I think
Okay.
quotation. So is it fine to talk?
Perfect.
Yes,
Go for it.
quotation you get before the service, and then invoice you get it after the service.
Yes. That is a very good point. Yes. Quotation is way before you do the job. This is like specifically if you are like supplying things, if you also a business that, yes, that not only then does like uh that does like any GP work, um, right? And you are actually then selling products as well. It is like, and you're supplying products to a different company, for example, and then a quotation would then be necessary, because if if it's a business that's wanting that particular items from you, you would then provide them with a quotation, right? First, before anything, you provide them with a quotation, and they then would then choose to accept the quotation or not, right? So let me just give you an example of that. So with a quotation, for example, this is just a quotation example, right? It would have the value items that people ordered, for example. They would have a quantity, unit price, and total price. So people would then accept this, um, and then you would then either supply them with the products, and you would then follow up with an invoice. So yes, um, then there's another thing where there's a pro forma invoice. So this is where you can maybe discuss terms. So for example, if you want maybe people to pay maybe a 60% upfront payment for whatever you want to supply them, um, you would then you would then give them a pro forma and they would then pay on this. But I want to make note that a quotation and a pro forma invoice is not a legally binding document. So people won't necessarily pay you, and you don't necessarily have to pay um, any business um, if they present you with these kind of things, right? What is gonna be important is what is the legal binding document is the invoice, because that's the agreement you supplied, and that is then necessary for payment. So this is also like a just an example of what an invoice could be. But the important thing to note is, um, I mean, never, especially if you're running your business and another company gives you a quotation, you are please do not pay on a quotation. Insist on having the invoice and only pay once once you are satisfied with the work, and then you would then insist on people to pay you. But note that mm, companies most companies takes about 30 30 days to like 90 days to actually pay an invoice, and they can do that. There is, like, if you want an invoice settled before, there is also room just to negotiate, um you maybe give them a discount if they settle the invoice early. That's a mechanism that you can use. But I mean, do you want to give people discounts on services provided? That's just something that you need to think about. But do keep in mind that businesses can take 30 to about 90 days at most to settle an invoice, right? So is there no other questions regarding this? We all clear on the difference? Cool. Okay. accepting payments. So if you guys are running your practice, it is important to note, and also very important to make sure that you accept more than one form of payment other than cash. So it's um, it's a good mechanism to use um, if you're accepting cash, if you're accepting any other form of payment like a rewards program as well, and also card. So it's very important to also then ensure that you actually have card facilities, because like people like me, I don't always carry large amounts of cash. And if I want to go visit a doctor's practice, for example, and I phone to make an appointment with you, and you tell me, oh, no cash on, I'll go somewhere else because now I have to go draw money um, in order to make sure that it's just a slight inconvenience. So also just make sure that for your customers specifically, you have more than one way in which you accept your payment, right? Then assets. I mean, I'm not gonna dive right into like a deep dive on assets, but I just want you to understand, like, in terms of assets, and if you're running a business, you need to determine what those assets is, because it will benefit your business, for example. So if anything should happen, for example, if you need to if you if God forbid anything happens within your business, there has to be um some sort of asset that you need to then let go of, and you would then, like, I need you to think about um like assets, like in your business. Once you have it, it's anything that you can sell that will still bring you in money if, Lord forbid, anything happens like within your business. So that's just another thing to note, right? In terms of like really investing in assets. And then revenue and expenditure. So who wants to give me the difference between the two of what revenue is and what expenditure is? I have a follow-up question to that. Is revenue profit?
Hi, Grant. No, I think revenue is all the money that's coming through, all the money that's coming in total, and expenditure, all the money that's going out. I think.
Yes. No, that's spot on. Yes. Revenue is all the income that you accumulate over a certain period, over a certain month, over a certain year, right? And also in terms of um expenditure, it is exactly that. Everything that you spend in order to ensure that your business is still running. So it could be operation expenditures, anything that you need to buy, other consumables that you need to buy within the business. So all of that. And then once the revenue and the expenditures are reconciled, that will then give you either profit or either give you loss, right? So that is um what it is. So yeah. So in terms of like profits, right? In your business, and I'm pretty sure that most of you have already um done conducted any form some sort of business before, like your profits. So what do you actually then do with your profits? That's just something I want you guys to answer. What do you actually then do with the profits that you make with your business, right? And likewise, I also want you to answer the question, losses, and like what do you actually even do if your business is running a loss? Do you increase your price? Do you spend less? Do you get different suppliers? Those are just things that I want you to consider when you are actually running your business. What do you do with your profits, and what do you do with your losses, right? I mean, that was it. I guess it's very basic. Thank you, everyone. I'll just maybe see if there's any other questions or comments. Um, I don't know, Chair, do you maybe want to come in here? Because I know that there's been a question from Mikhail
Oh, sorry,
or
guys.
a comment.
Yeah. So I just want to add also to what Grant was saying about revenue and sort of profit. So I think if you guys remember, I mentioned yesterday, I used a word called margin. If you guys remember, I explained the car dealership and cost of sales and all those things. So it's very important that you guys have an understanding of that because when your revenues come in, what did we say yesterday is the most important thing when it comes to making sure that margin is solid. It is managing down your costs and being as efficient as possible. And you almost have to, in the beginning, kind of remove yourself from the equation, but you obviously can't completely remove yourself. But when it comes to margin, healthcare is a high margin business, okay? Because it's a services business. So a services business, the only real cost is going to be people, consumables, rent, which we don't really have, but in the traditional setting, it would be rent. In the GoGP setting, it would be sort of platform fees, the surcharge, small things, right? There's no big set costs, okay, which is a very uncommon thing sort of in the market at all. It's a little bit more common in the creator economy where people are doing things like OnlyFans. I mean, sorry, not OnlyFans. I'm just joking. Any form of sort of platform related production of service being sold, right? So that is an important construct because you guys are we are shifting into a hybrid between the gig economy, which is and sort of and building a business. So your profit or your margin that you make is going to be dictated by how well you can manage down costs. So if you invoice out for the month to the GPs, you invoice 50K for the focus scans, and then your revenue coming in from your consults is maybe another 50,000. Between those two, that's your top line revenue, and then maybe you're selling some vouchers, you're doing some work care product sales, you're getting people on the platform, maybe you're doing a talk here and there, you're charging for that. All those things contribute to your revenue, and all those things are going to be invoices that you're going to be sending out and getting money in for. Okay. Once you've worked out everything, your costs to get there, to do it, and this is a thing that a lot of doctors don't do. In general, I'm talking on the traditional sense. They don't really focus on managing their margin. They just kind of see a bunch of patients. Oh no, I saw 100 patients this month, and then to them, that's just like that's the money they made, which is obviously not the case. So yeah, so I think it's very important to distinguish because you guys are going to be doing a combination of selling services and selling products, which is very cool. Okay, that's a nice mix. So then, Mikhail, you say financial climate where even the most privileged still have no. Okay. Yeah. Okay. You don't want to exclude. So I'm with you though, Mikhail, and you'll notice. So one of the biggest challenges with a medical aid, right, is something called cash flow. So with a medical aid, obviously patients have already paid for access to healthcare. They've paid to the medical aid. And ultimately, the medical aid must pay you, right, in the traditional sense. Many things can happen which stop the medical aid from paying you, right? So you the one carrying the risk, and this is the mechanism behind what drives private healthcare and why it is such an sort of bias. It's an economically flawed model, right? So we as the provider, you're actually carrying most of the risk. Okay, so when a patient comes to see you in a traditional setting, right? If you're a traditional GP, you accept all the medical aids and whatever. When that patient's coming to you, there's an expectation from that patient that they already are covered. Whether they are or not is not a guarantee. So there may be many reasons that they don't that they won't be covered. So maybe they don't have day-to-day benefits. That's a very common one. You'll see things like because there's been a shift in medical aids and shift to this insurance thing, which I think Bianca mentioned the other day. We were talking about the Dis-Chem insurance models, all these low-cost insurance products. To the end customer, the patient, who's in this setting is our customer, is the patient, they've already paid. So they're thinking they're already covered. Okay. So now when it comes time, so what you should do, and this is something we do in our traditional, where we have elements of our traditional business, we do benefit checks. So we've got, a front office that does benefit checks, and establish whether or not this customer can actually, does actually have the funds to cover this consult, does the medical aid cover X, Y, Z. But you see, that is another cost to you, to me. So I need to put another human body there now to do validations and check. So that then eats up my margin. So when you think of a business, there are specific things that need to be in place for the business to work, okay? So if you're thinking, and again, guys, I'm just speaking medical aids now for Mikhail's question. And I'm speaking specifically, and I'm leaning more towards the traditional, so that to your comment again there now, Mikhail, about having a person to pay and check and so on. We are building a micro hybrid business here, and I think if you remember yesterday, I said the best thing to do if you keep it within a certain size is to do as much as you can, right? You are a bit of a solopreneur. The challenge is a business needs to be able to work without you in it, okay? But for now, in the first step of the ladder, you're going to be doing a lot of the work. So you need to bring in some form of automations and systems that you can use, okay? But I would say registering with the medical aids is not a bad idea, because ultimately, like I said, there are customers and patients. The challenge is that they try to dictate where and what patients can get access to, okay? And this is why things like NHI are kind of being pushed in, because there's too much control and too much, it's very greedy industry, the medical aid and insurance industry. You guys know medical aids are supposed to be non-profits, which is, you guys know, is not the case. So medical aid operates like an NGO, so it's supposed to be a non-profit, but then they've got another business separate to it, which is a management company, which then charges management fees for managing all of the contributors' funds, okay? And a medical aid needs to maintain a certain level of liquidity, which is basically a certain amount of money in the bank to be able to pay for certain things. And the Council for Medical Schemes has a tight control of that, and it sort of forces a medical aid to maintain a certain pool of liquidity. Okay, that's a medical aid that operates under the auspices or the guidance of the Council of Medical Schemes and a medical aid, sort of the Medical Aid Act thing. That's very different. As I know, it doesn't look like it on surface level. It is very different to a medical insurance, because a medical insurance is a financial services product, which operates under a completely different rule and completely different law and a completely different framework. Okay, medical aids need to do certain things. Financial services or medical insurance products are not bound and not forced to operate within a certain framework. So they are a little bit of the wild west, very regulated, yes, but they get volumes of patients in, and those who sort of not suffer, but who carries the most risk is the provider, which is the doctor, right? Especially primary care day to day. Doctors who love medical aids are obviously specialists and ones who are in hospitals. Okay, they are, I mean, for them it's the best thing ever, because it's a guarantee and they can charge 30% over medical aid rates, all these crazy things. But who suffers at the end of the day is the day-to-day stuff. And it's all sort of mathematically or actuarially modeled. So from a medical aids point of view, if you think about a value, what's important to them, it's less likely that you're going to need or the probability of somebody going to hospital and having an MI and needing a R1 million procedure, blah, blah, blah. is less likely looking at the data and will maybe happen a bit later on versus, you know, 1 million people who every day need to use the GP or, you know, do a consult here, consult there. So the medical schemes, the medical aids or the medical schemes or the medical aids and so on, they do actuarial models that ultimately, from a probabilities point of view, reduce the likelihood, or they would cover the things least likely to happen. So you guys have, I'm sure you've all seen like they have some random stuff on their disease coverage lists, right? And it's not by accident, it's not to be funny, it's just those are the things that sort of, I guess, from actuarial standpoint, they can say they've covered for it and they bring the coverage in, but it's unlikely that it's going to happen. So out-of-pocket spend, if you look at the data, the out-of-pocket spend in South Africa for day-to-day benefits has gone up by, I don't know, there's a number attached to it. You guys can go double check it. There's a lot of research on it. I don't want to give the exact number and I don't want to be wrong, but it's gone up significantly, okay? So that says a lot, right? That tells you everything you need to know, because now the economic pressure that's being applied to the average person on a day-to-day basis requiring access to healthcare is significant. But to the medical aids, they are still saying, we are selling you a product that's got a good value proposition because we're increasing your in-hospital benefits, or we're increasing this, increasing that, without changing the premiums too much. So medical aids is something that I think it's important for doctors to understand and get familiar with, because the economics behind it impact the doctor's lives in a big way, right? You need to know that for them, their biggest pain is to pay the doctor, which is completely ironic because their business is supposed to be providing services or access to healthcare coverage for their customers, who are ultimately going to be your patients. So that dynamic, right, and the way the private healthcare is structured in South Africa is really part of, you know, the challenges we face. But many doctors do many different models, right? So you see, Mikhail, if you want to do that cash thing and you want them to claim, right, you need to be registered, okay? So you need to be registered with the Council of Medical Schemes and the BHF and all that, because the Board of Healthcare Funders is the intermediary structure. Okay, so and if that patient's medical aid is not doesn't, or you're not covered, or what you're offering is not covered, or there's a lot now where the medical aids don't want to put doctors on the networks because they say there's saturation, not saturation, but they oversubscribe in certain areas, which when you ask the patients and you look at the sort of waiting times and access, you know that not to be true. But again, remember, the medical aids model is to protect the pool of funds, right? This is stuff I don't want to tell you guys. So this is our little IP community thing. So let's keep it here. But that is sort of part of the medical aid discussion, I guess, if we could call it that. And it's an important thing for, I think, doctors to understand. A lot of doctors sort of turn a blind eye to it in a way. I wouldn't say turn a blind eye, but don't sort of make an effort to fully understand it. And I think once you understand it, if you look at what we've spoken about over the last few weeks, looking at, you know, value propositions and all these things, once you understand what's important to them, you can actually present or discuss something with them. So if I could ask you guys a question quickly, since we're on medical aid, sorry, Grant, I know I'm going into something else now, but I think it's important. If you guys had to think about a medical aid, right, and you were to go present something to a medical aid that you think maybe would be useful for them, is anyone able to maybe give me a thought or an example of something that they think might be presentable to a medical aid that could allow you to work with them? Keeping in mind, if you remember what I told you guys in the first week when I had the meeting with Momentum, met all the executives, everything, and remember I said that they had no control of the quality of the care the doctors were giving their patients, which was a indirect relationship because the patients perceived it as a momentum thing. And then they turned it down, even though it was a value proposition. I thought it was a value proposition for them. And then they said, no, but they need to protect the pool of funds, etc. If there's any sort of thing, anyone, like if you have a thought of what, if you've thought of an idea that you maybe thought, okay, maybe I can pitch this to a medical aid and do a deal with them or something. Is anyone got anything like that maybe we could look at? I'll give you guys one afterwards, but I do want to hear if anyone.
How's it, Dad?
Yeah.
I'm not sure if this is entirely correct, but I'm busy trying to get into the retreat medicine space, and we've been wanting to approach Discovery or a medical aid to see if maybe with their vitality or with the kind of idea of prevention better than cure, trying to get medical aids to cover for people to go on health retreats that are maybe either burnout related or more preventative. And yeah, it's been an idea for a couple of months. So I don't know if
Okay.
that's this is a bit different to the
Yeah.
I don't know if that's fun.
No, I'm with you. Okay, cool. So again, now if you have that idea, you need to understand what the medical aids or insurance companies operate like and what they're willing to and not willing to pay. So they're going to look at it and say, okay, how's it going to benefit them, right? Not the patient, not the customer. They're going to say, how's it going to fit into their commercial model? So like I've been admitted to these retreat things before for burnout or, whatever, mental health issues, anxiety and stuff. And yes,
Yeah.
with some motivation, the medical aids covered some of it, but it's not.
Really?
Yeah. But again, it was Discovery, which was, I mean, by chance. They're not the best, but it was a lot of
Yeah.
motivations and all these things. So there are ones that do cover it. But if you think about a medical aid, I want to give you guys a practical example. The medical aid wants to limit the total that you are going to cost them over time. Okay, so it is in the interest to keep people healthy if it's going to prevent potentially, if it's going to prevent potentially somebody from getting an MI or something that's going to cost 3 million, 4 million rand, to pay for that procedure. Okay, so if you think of something like an initiative, so if you use us, so we've got a model called Managed Care, okay, and it's something we sell to patients, and we've pitched it to GPs, to medical aids, and it's something you definitely can go and discuss with potentially a medical aid. Because managed care is something where you say, okay, if I've got chronic care patient with diabetes, hypertension, you have a baseline HbA1c of, let's say it's 6 or 7. Let's say it's 7. There's a baseline HbA1c of 7. If you prove that through intervention, lifestyle changes, your medications, and so on, you manage to reduce that HbA1c over time, let's say over 12 months, from 7 to 4, whatever, you've proven that you are actually on a biochemical level improving that patient's baseline health, which will in turn reduce the risk of that customer, okay? And then over time, it's less likely that they're going to require some crazy admission that's going to cost millions and millions of rands. So I'm just using it as an example because even when you guys are starting and you're going out with your Go GP models and you're thinking about an initiative, you have to tie it back to financially and commercially, what is their priority? Okay. So to Christelle's point, I want to add something here on this vitality thing. So what's very interesting about the concept of vitality is that it is very replicatable at a smaller level. Okay, so if you doing deals and partnering with GPs and you're finding yourself, going out, getting a patient base. Remember I said yesterday that healthcare is quite low on the spending hierarchy and you need to bring it up by doing partnerships and collaborations with things like a grocery store, where you can give people discounts or access to healthcare if they, buying healthy foods, or you do partnerships with supplements companies or anything like that. You can find collaborators and partners, because Vitality is basically a rewards program, and you can build your own rewards program, right? Within your reality. So when it comes to medical aids and the model of medical aids and engaging with them, it is in the best interest to do so. The main reason for like an ink structure or ink setup is primarily just for registrations with the medical aids. If you're just doing cash stuff, you have an MP number, whatever, you can transact through a PTY, no issues. But the challenge just comes in when it comes to the medical aids. So if you've been locuming and you've been, selling your services and things, and you're running it through a PTY, that's perfect. But as you're going in now, you want to expand a bit, you want to bring in the medical aids and so forth. Because remember, when you're selling your poker services, you are not actually going to be submitting to the medical aids. Okay, you are going to be invoicing the doctor whose patients it is. So they'll be they'll be claiming from the medical aid. So you can do a relationship where you de-risk yourself. You say to the doctor, this is my invoice. They can pay you up front, and they then get paid once the medical aid settle. And this is what I said earlier about the cash flow. When you are dependent solely on medical aids, you are very much dependent on them paying you, which will impact your cash flow, because sometimes medical aids can take up to 6 weeks to pay. And you just have to sit and wait. So yeah, so I think that sort of answers some of that, Mikhail. And I think it's important that it's discussed and that we look at it now. And ICD-10 code for burnout is legit. I had burnout, and it was a legit ICD code, and my medical aid, which is not the best medical aid, it's a Discovery hospital plan, not even a full medical aid. It covered. Okay, let me just see this quickly. Cash payment. So a lot of Jews are going to hate this extra. So hold on, I'm thinking GP's point of view. How do they then bill the patient for the service? So they bill it as if it's like standard, as if they did it. Okay. So they are then able to, from an ICD code point of view and from a billings point of view, they can obviously increase their billing revenue, because they will just add it to the patient's consult as per normal, right? The only difference is that there's now a cost for them attached to being able to add that to the billing code, because they must now able to offer focus, right? You're not giving them more admin, you're just giving them, the only admin add-on is that they're gonna have to pay you. But they follow the same protocol as per normal, as if they did the scan. It's nothing changes. The same ICD code gets billed, etc. They get the remittance and then they get settled. That's why I'm saying you can, depending on how you structure your relationships with the doctors, I guarantee you some of the GPs are going to overcharge to the medical aid. That I can tell you already. You're going to have an agreed rate with them. They're going to check what they can bill for it. They're probably going to want to make some margin on it. Not saying all of them, but if there are some savvy ones, they'll try to do that, which is not a bad thing. But it's going to just run as another ICD code for that patient's on that patient's billing. Okay, so yeah, we don't want to give them extra admin. The only admin is that they just have an extra cost, but it's from revenue they didn't have before, if that makes sense. Okay, so you're bringing more revenue into them. Yes, it's going to cost them some money to pay you for that scan, but they keep some of it, and that's a plus for them. Sorry, I'm done.
No, it's actually quite interesting. Like listening, because I didn't know like much about like the in depth of like the medical industry and stuff. Like my mom's a enrolled nurse, so that's about it that I know of medical based off what she told me. But it's actually good just to like hear about um like the pain points that you guys as doctors I come across and stuff. I mean, there was I was actually thinking of an idea that food that you maybe would consider if medical aid is being obtained? Um, how how would you guys feel about maybe just doing maybe a subscription model to one of your like your customers?
Yeah,
Like
so
instead of
that's
going then through, yeah,
yeah,
instead of going through,
we've discussed it. We discussed it with everybody. So we've got a subscription model that we build into
Okay.
your revenue model. So you're selling the work care packages, which is basically a subscription, and then once the patient becomes your patient, you are also able to work in a subscription model. However, because so just for you guys on the call, also just to make sure you understand this, like the Council for Medical Schemes, the CMS, they are the ones that overreach and dictate how doctors are able to charge for services. So a few years ago, it was completely like you can't do anything other than just medical aid and so on. They try to prevent doctors from operating like a medical aid, or they want to control everyone that is sort of delivering services to patients or customers, in this case patients, and they kind of force it to be fee for service, and the patient can only pay the medical aid for certain things. So yes, all the recording will be on the LMS. Yeah, so I will do. Yeah, that there's been no commerce training or economics at all, nothing. So this is obviously the main focus of this first 2 weeks was to give you guys this, and we'll make it's going to be available on the LMS, and then we'll also be available, and because you guys are in the community, I'm also available for further engagement, and we can maybe have some more webinars and things as needed. But just so you guys understand, in the US, for example, there's something called direct to provider care. Okay, and direct to provider care is basically that each doctor has a direct relationship with their patients, and the commercial relationship is there. Okay, you are able to, charge subscriptions and fees and things, and they can pay for it upfront. You can do whatever you like. In SA, little bit different because the Council for Medical Schemes dictates and tries to overreach and has an overarching kind of framework for who can do what. That's why there's been so many insurance companies popping up, health insurance here, etc., because they want to be able to capture this middle to lower end of the market, and they are governed not by the Medical Aid Act, but the Financial Services Act. So to Grant's point on the subscription model, so what you have to do, and which I've packaged into this thing in yesterday's discussion around the vouchers and work care and so on, you need to create an alternative thing for somebody to pay for or to buy, okay? So that you basically give them a product that they can pay for to gain access. So when you sell a voucher, like we said yesterday, you sell a voucher, a virtual care voucher, for example. I can buy 100 of them, and I can give them to Grant, I can give them to Marlon, I can literally give it to anybody. But that is a promise of future access to healthcare, and it's already been paid for. So you guys would have noticed prepaid health, like these prepaid vouchers from Netcare and all these things. Historically, 5-6 years ago, it was completely frowned upon to have prepaid healthcare. It was not something that it wasn't even allowed. But as things have evolved, obviously things are changing, and NHI by itself is universal health coverage, which is a capitated model, which is paying for a basket of services for a group of people in advance, right? So this is an entire shift in the market, and it's a unique time now to start building business models like we are discussing, revenue models and so on, which give people alternative means or mechanisms to access healthcare. Okay, so that's why as you guys are going through and in your communities, you spoke about the flywheel effect yesterday, you're gonna find a new model, a new thing that could work, right? And the beauty of it is you can try it. You can literally try it, and there's no one's like forcing you or you must do it this way, must do it that way. You need to meet the patients where they are, and that's where the innovation is going to come in. And I'm hoping you guys sort of take some of the learnings over the last few weeks, and if you check in, watch it again, engage with it again, that it really kind of sparks something when you're out there in the market. So yeah, it's a lengthy. There's a lot to discuss in it. There is, this is now from my side, like years of fiddling with it, engaging with the medical aids, engaging with the insurers, going through the process of trying to start my own insurance business, seeing that it's not what you want to do, realizing that the value sits in the hands of the provider, actually, as much as the market and the medical aids and the industry has shifted it the other way, where the medical aid is in control and all these things. The long and the short is that the delivery of the service is going to be dependent on the doctors. And the ultimate beneficiary, other than the patient receiving healthcare, I'm talking beneficiary as an exchange of money. From step one, the patient is paying to the medical aid, so now the medical aid or the insurance receives that money. Their model is they need to get as much money in as possible to make sure their pool is big enough. They take a fee of all the money they're managing. And there's lots of admin processes and staff and things in the background which cost money for sure, but it's basically just a massive admin step that they put in. And then the beneficiary of the money, once it needs to go somewhere, is always the clinician. It's always the doctor, right? So you don't want to cut off medical aids completely, but you don't want to be completely dependent on them. You need to see it as one of your income generating relationships or partners. So see them as a partner in a sense, but know that, we spoke about the other day, stacking up your income earning opportunities and things, it's just one of them. Okay, so when that locum pays you, for example, they're paying you off fees earned from some cash patients and some medical aid patients. So yeah. You can go on, sorry.
No, I think thank you everyone. I mean that is it from my side. I don't have anything else unless there is any one of the doctors that has any final comments or questions that we can answer before I have to drop off.
I think, Grant, if you need to drop off, then I'll stay on for another 30 minutes with the doctors, and then we can go through some of the specifics when it comes to sort of the financials and things, and if that's okay. Is that fine with you guys?
That's fine with me, Dr. Chair. Thank you.
Okay.
See everyone.
Yeah.
All of the best with your business ventures. I appreciate your time and listening to me. Thank you very much. Bye.
Cheers, Grant. Okay, cool. So I'll just do another 15 minutes or so with regards to the financial masterclass. So from a numbers point of view, the structuring and the setting up of the companies is phase one. Okay, that's quite important. I do believe it will be in everyone's best interest to do an Inc. I do think everyone should register independently with medical aids under your business. I think it also gives you some autonomy and it gives you that option, right? It is not that I want you guys to be dependent on it. Everything you also see, even on the virtual care side of things. So when we built our virtual care platform, we actually didn't even put in that it accepts medical aids because you are so dependent on the medical aids accepting things, or some of them didn't. Some of them, up until this day, they only accept virtual consults, but under phone call consults or something like that. So we are always moving. The market is moving faster than regulation and incumbents and so on can keep up. So we need to kind of work alongside them, but not be fully dependent on them. So you'll see a lot of GP practices in the traditional setting. They would do, like I think Mikhail said, cash only, and then the patient must do the submissions and things themselves. So if you're in the business of trying to have value proposition, customer experience, and so on, there's a cost to that, because now you're bringing in a model where where you're bringing in a model where it's you know, you are now a little bit more kind of flexible, and it's not the sort of standard model. So yeah, so like Tegan said, that's the code, and it's about 180, which is obviously way below, what you yeah, or 130 exactly. But you can charge, you know, 350, 450. That's kind of what it's what someone's able to pay and willing to pay for. The challenge is sometimes that the patient will feel, oh, but I already paid for this thing. But another thing you'll realize is that most patients don't know what they are covered for. I mean, do you guys know? I don't know all the stuff I'm covered for. So they have a expectation, but the medical aid doesn't even make an effort to kind of educate, because the more barriers there are, the better for the medical aid, right? Because again, the risk, it's all about where the risk sits. So now you have to go and chase your own money if you know, with the medical aid. So then that becomes a debtor's book. And that debtor's book is basically, you know, people that still owe you money for the service you've already rendered. They just haven't paid you yet. So they don't want you to have prepaid healthcare, but they also don't mind if you deliver the service before getting paid and then paid eventually. So it's just, you know, the disempowered clinician is how the industry wants it to be. But it is very much like a cat and mouse game, always changing. It's like I said, they put barriers in place because they need to protect the pool of funds, which is their pool of funds. And the frustration is oftentimes directed to the clinician, right? When it's not your fault. You had no control of what the patient's or the customer's medical aid covered. Okay, so that's kind of one of the big things to look at, and to understand, because it does form quite a big part of your business. So I want to go through something quickly with you guys that we can think about. And then we can sort of close off after that for today. And then I'll just give you guys a sort of plan for what's happening next week. And then you guys can go have a good Friday and think a bit about things that we've discussed. So when you set up your entity, right? Remember, you're setting up a quote unquote practice. It's a business, but in the setting, you are in the business of delivering healthcare. And if you look at the traditional wording, you would say that is a practice, which is a type of practice. This is a type of practice. And when it comes to, it's a very simple business, right? It's not a complicated business at all, which is a good thing, because you are able to generate an income selling your services and your time. You're able to generate an income selling products. Access to healthcare can be a product. You can build your revenue streams, which is your income streams, from additional sources. And you can run this through your business, right? You run everything through your business. You have very limited costs when if you're running in the solo setting. If it grows and it gets bigger, then it starts getting expensive, because now you need to bring in other doctors, you need to, you know, there's admin people, there's fees, software fees, all these things that does add up. And you can only charge so much in the market, like we spoke about yesterday. Wherever you find yourself, the LSM you're operating in, the types of services and who you're offering it to, there's a set price for that you can charge. Okay, and you need to kind of reverse engineer how you want to sort of operate to make sure you manage the margin, which is how much profit you make at the end of the day. And you can bring in very, very simple sort of systems and tools to drive efficiency that you can do. But you just need to get into the mode of being an owner operator. So that mode must kick in for you guys now, in that you need to sort of, you're going to be learning and acquiring new skills and things as you go. Even if it's foreign to you now, right? You're gonna start learning how to do. Like, I remember when I started my first business, I was building websites. I was handing out flyers in the parking lot. I learned how to do almost everything. I didn't learn how to code. For me, that's not necessary. I felt it's other people can code. But you're gonna learn different skills. You're gonna learn how to draft simple things. You're gonna use sort of ChatGPT to assist you with simple stuff. You need to get yourself into this mode of, I don't maybe know it now, but I'm on this journey now of learning as I kind of figured it out. And I think that is an important thing from a frameworking mindset point of view, because there's going to be stuff you don't understand and don't know. And that's a good thing. As much as it feels frustrating, it's a very good thing. Because, like I said, we in the healthcare space, there's a base assumption of the level of clinical acumen and stuff you have, right? What sets you apart is not how good of a doctor you are from a clinical point of view. Yes, it's important that you need to be on par and you need to, not miss anything and all that stuff, for sure. But where your USP, which is your unique selling proposition, comes in, is more down the lines of what you can offer to the market. So when it comes to numbers and money, from a financial standpoint, the structuring and setting up of the business is phase one. Now, once you're operating, okay, you're gonna have a bank account, right? And that bank account is gonna ultimately become your sort of, where all your revenue, your income is gonna go to. You're gonna be sending, you're gonna be paying things from there. You're gonna be, what else? You're gonna be, that's sort of ideally gonna become where you operate from, right? You even can pay yourself from there, going forward if you want to operate like that, or you can just run everything through your business if that's how you want to do it. Because if you are going to run this thing and this is going to be just for the purposes of building your GoGP model, expanding your practice model as you go over the next few years, I would then sort of focus on running this business as my life, basically. I'm running my life through this business. You guys can chat to, I again would advise having an accountant. I know some of you have, some of you don't have. Don't get a super crazy best in the world firm. Just get a simple service provider who's not expensive, who can look at your bookkeeping and sort of just help you manage that. Okay, when it comes to annual returns and things like that. It's very important, especially now because you guys are independent. Right? So post ComServe, when you work in ComServe and stuff, you're earning a salary, that's a very different story. You were just an employee, you just kind of went to work, everything was taken care of for you, but you had no flexibility. Now that we're going into the realm of independence, you need to get your mindset right now to the fact that you are indeed independent. Okay, so there's lots of benefits to being independent. Right? You can decide how you want to run your lifestyle, etc., etc. And you have the freedom to generate as much money as you want. That's the beauty of being an entrepreneur. You have the freedom to make, there's no cap on it. Like yesterday I said, I think you guys should target 200,000 a month. That's not necessarily the cap, but there's a point where it goes beyond that. Now you need to bring in more costs because you need to be able to operate and service as you scale up. Like in my one business, for example, my fixed cost a month is R1 million. Okay, so I need to pay salaries. This is not in the traditional business, like the not traditional, but the hybrid care delivery model. I've got to pay my staff, I've got to pay my doctors, got to pay rent, all the stuff, R1 million a month. Okay, so which is a lot of money. And some months when things get hard and things don't work in the month, someone needs to pay it. And because I'm the shareholder, I'm the majority shareholder, it ultimately, the responsibility sits with me. I can't not pay my staff. And there have been months for sure. We have December and Jan, it gets slow in healthcare. Right? So people on holiday, etc. So you need to prepare somehow for these months. And the best way to do that is to keep it lean this is why the GoGP model is what it is. It's a lean model where you are in control of it, and you are supposed to be the ultimate beneficiary of it. So the bulk of the money must go to you, right? At the end of that month or at the end of the quarter, you need to look back and say, yo, I made a lot more money than I would have if I was locuming, which is going to happen because you're adding locuming into your income stream. Or if you work in government now and you got an MO post, you'd maybe be making 75, 80K gross max. You'll be working shifts, you'll be working overtime, you pay a massive tax bill also because you're a government employee, and you have no control over that. That's just gone. So there's a lot of benefit to independence, but it comes with a little bit more work and a little bit more risk. But I think it's a space that you guys we find ourselves in now. It's an amazing platform to build from, where you can build an income from and build a proper life from it. So I was going back to your account. So that bank account of yours that you're going to be operating through, all your revenue is going to flow to there. Your costs are going to be paid from there. I would advise sort of trying to run your life through it as it grows over the next 12 to 24 months. And there's not a lot of you should try and limit the costs within the GoGP model as far as possible. And that would be done through keeping it lean. So don't bring on too many people, too many things too early. Get yourself to capacity first. I think that is an important thing to so that's why I put those numbers in there from a capacity point of view. You need to get the model to capacity before you start adding costs, because you will need to at some point, but first get there. Where you're working, if you say, okay, I'm working too many hours now in the week, nothing stops you from getting a GP, a locum doctor who's selling their time to maybe consult some of your virtual cares, for example. Just an example. So so if there's any specific questions around the financials, I would strongly suggest, just as it's just best practice, I think it's a very good idea now to sort of put on the boots and say, I'm gonna go chat to my accountant or meet with somebody and say, this is the journey I'm going on. Because for me, it's a case of I want you guys empowered to know that you are in control of it and you're comfortable with everything you guys are doing because you went through it yourself, and you kind of I just want to steer you guys in the right direction to give you the frameworks to work in. And I think that's really it. That's the main thing for me from a I guess financial point of view. You set a target for your revenue, you manage your costs down as low as possible. Each deal will be specific, each deal will be unique. I'm available to discuss once you go chat to your GPs. If any issues or any questions come up, we can discuss it together. We'll help you guys through it. And this is just the platform to build your practice from. So if there's any other specific questions I can answer or look at, please pop it in the chat or ask me. But there's not really that much to discuss. I'll show you guys the models. It will be available on the LMS. The financial model, we'll put templates up for the SLAs, which is service level agreements. We'll put up a template for your income and expenses on like an Excel template for that you can have a look at. What else will we put on? We'll put on a sample of an invoice. We'll put on all the basic frameworks just for you guys to have access to it. So that I'll work on with Grant and stuff after this call. But I didn't want to put too much emphasis or pressure on the sort of financial side of it now. I just want you guys to understand, focus on the revenue target. So you set a target for revenue and you reverse engineer the how that's going to look, right? You reverse engineer how you're going to get there. Sorry, I'm just replying to someone. You reverse engineer how you're going to get to that 200,000 and 150,000, whatever target you set. And that's going to be a function of number of scans you can do and sell and so on, number of virtual consults, and all the other revenue streams that we've made available that you guys can use to generate that income. Okay, and then there'll be more that come up from yourselves. If you're gonna go do talks, if you're gonna go become a thought leader, you're gonna go and become you're gonna become someone that contributes to publications and media. Those are things you guys can do and we can all do. So that's why the Go GP model is 2 tools to generate an income and a platform for you guys to use to go and expand into other sectors or other parts of healthcare where your customer changes all the time. So if you go from GPs to patients to a magazine to anyone that could potentially benefit from just give me 1 second. Sorry guys. If anyone who could potentially benefit from your knowledge and your IP that is able to pay for your services and your knowledge, right? That is ultimately, from a financial standpoint, that is ultimately what we're pushing for. You guys need to make money, you need to make good revenue, top line revenue, keep your costs down and make as much profit as possible. And that's really the beginning and the end of it. It's a platform for you to build a lifelong business from. So we are having a discussion with a partner called Stub. We'll probably have one more webinar session with you guys where we'll introduce Stub. Stub is a accounting software service provider person, a partner of business. And they want to come on board and obviously give you guys zero rate certain things and make it very affordable and so on. And this is what I was saying about bringing in efficient systems and partners and tools, because it's not, things are not like they used to be like 15, 20 years ago. There's enough resource, there's enough knowledge available. I mean, I use ChatGPT for so many things. You could literally build a sort of revenue model for your Go GP business, right? Using ChatGPT. Nothing stops you. You put in how much you want to charge for your scans, what you're going to charge for your virtual consults, how many locums you want to do, what your rate is for locums, how many hours you're willing to put in the week. And you can literally create a full-on monthly sort of budget where you can budget your business month by month, based on how busy you are. And that's really the beauty of it. That's the art of independence. Where you're kind of in control of it. I think that's all for today. Like I said, we'll put some more resources up from the financial side, and then we'll have the session with Stub. For next week, so the next phase of you guys from a training, from a sort of Hlola point of view. So next week's going to be a bit of a practical week. And in the practical week, okay, that's good. That's good. Yeah. No, you guys must feel 10 out of 10. There's enough customers and patients in SA for everyone to make good money. So next week, basically the plan is it's a fully practical week where we won't necessarily have a session. But I might send out something just to have a session maybe on the Friday, just to prepare you guys for the start of the clinical, which is the following week, and then also just sort of have a check-in on the progress during the week. So for next week, what we're hoping you guys are able to do is pair up with another doctor in the cohort that we can work with. So that's step 1. Then the second thing would be that we're hoping you guys are able to go and have a discussion with at least, or see if you can onboard 3 GPs each who are going to be interested in taking on your services from a point of care ultrasound point of view, which I think is important. That's going to give you guys a good feel for what's to come and how it's going to be when you go into the market. And once you do it and you get it, you don't have to stop. You can start building up your customer base already. Okay, so you can literally start now building up your partners and your GPs, and your, the GP partners. I'm gonna ask Cindy to, Crystal, I'm just gonna ask Cindy to send out the cohort list so everyone can see who's from where, and then you can, from that list, communicate with the doctors and see if you can partner up. Yeah, I'm getting there now, Mikael. So that's the first thing is to have those discussions. What I'll do is I have a SLA draft, which is a draft SLA, which I'll ask Cindy to send each of you guys today or maybe on Monday, which is just a template. It has basically, it's not an SLA, it's an MOU, memorandum of understanding, which is a document that kind of can be used to guide how a relationship's going to look. So it'll have your responsibilities and your GP partner's responsibilities. So I'll send that out as well on email. Well, I'll ask Cindy to send it. And then, so that's the thing. So you need to get these doctors to kind of be like, okay, I'm in, guys. Once you're ready, we can start. And spend some time with the GP, get to know how things work. And remember, I said we must put in the baseline data from each GP. Then the third thing is, to Mikael's point now, is to get 10 patients or 10 customers, whether they are a patient, a normal everyday patient, or a small business or some customers, to get them to sign up to to become your patient on the virtual care platform. So you're going to sign up yourself, number one, on the doctor portal and register your business. Give it a name, put a profile there, just say, the only thing that will have to be in there is just to say that it's sort of powered by GoGP, that type of thing. But you create your profile on My Pocket Health. There is access to an admin line if you have any issues. It's very simple though, but I'll ask I'll just tell the team running the admin portal just to have a look out for you guys. To register there, sign up, create your profile, and then start having discussions with potential customers, potential patients, friends and family, like we said in the discussion yesterday, and get them to sign up and sort of become your patient, if that makes sense. So target 10. If you can get 10 of them, you don't have to book a consult. If one of them want to book a consult with you, that's even better. If you get your first consult on the virtual platform, that's a big win. I would encourage you guys to maybe ask friends and family to maybe book a slot with you, get a feel for it, get into the feeling of, okay, I'm making my money now, it's coming through. That might be a good idea just to get that feeling going. Then what we also want to do next week is, if you guys can just send comms out, Cindy, and just also send out comms to the doctors around the setting up of their businesses, those who have and those who don't have. Everyone, if you could just kind of send a mail out that, ask, do they have a company registered, or yes or no? And if not, we can then start the process with helping them setting up the inks. So the PTYs and the inks. I know some already have PTYs that they're trading through. And I think that's sort of the main stuff for the next steps. We'll keep comm channels open. Cindy is monitoring sort of the mails and things. And I think that's really where we are. If you want, I had a suggestion to maybe create cohort specific WhatsApp channels or WhatsApp groups. Which if you want that, you can just, I want to do that. So I'm gonna say thumbs up. If you guys want to do cohort specific WhatsApp groups, that will also be cool. I just want to see how I'm going to get it right, because we have split all the doctors are split into specific cohorts. But I need to keep each cohort separate, because you guys are going through the program, on a rotational basis. And once you get to the training side, or the clinical training side, and the in-person, that needs to be a set number of doctors. So I'm gonna just chat to Cindy. We were supposed to have a meeting yesterday, but we'll chat on Monday just to see if we can just set up the different WhatsApp groups so long. So I'll start with cohort 1, and then I'll be available in that chat to discuss a few things, and we can use it as a community forum just to bounce some ideas around. it's only a group of 20. It's supposed to be a group of 20 doctors at a time, so it's not too big, and I think it's manageable. So yeah, I think that's sort of the steps for the next few. You guys can sort of just send Cindy send her an email about setting up your practice, whether you have one or not. You guys have Cindy's email. I think everyone should have Cindy's email. I hope so. And then we go from there. But yeah, that's the boot camp, the first 2 weeks of the boot camp. Pretty much done and dusted. I hope you guys learned some good stuff and we had some good discussions. I enjoyed it. It was really cool engaging with all the different thoughts and ideas. All the material will still be on the LMS to go watch it again, engage with it again. We'll continue to upload some more. You may have received some emails and stuff already regarding the clinical training and the webinars for the ultrasound training. Yeah, you can send it to that email. And also share that with anyone else who's, I know a lot of doctors aren't on here now, but I think Cindy, maybe we might just send out a com to all of the cohort 1 doctors after today. And then yeah, I wish you guys a lovely weekend. I'm really excited. I hope you guys kind of get into the flow next week. I think it's important. You can start the day already. We'll send out the login for My Pocket Health, the doctor portal login, and we'll ensure everyone gets approved. And yeah, that's the first 2 weeks of bootcamp done. I'm very proud of you guys, and I really enjoyed the sessions. If anyone wants to kind of share anything or comment anything, yeah. So sorry, Crystal. Yeah. So after next week, basically, it's gonna go straight into the first part of the focus training. Okay, so the focus training is gonna be a little bit less, not less interactive, but it's a bit more didactic. So you'll have time. So Joe and the team will host, 1 or 2 webinars in the week, but then you'll get access to the LMS where all the material will be, and you can work through it on your own time. I would encourage you guys to even during the clinical, start building out the model for GoGP. Think about everything we've gone through. Think of who potentially your customers are and start engaging. Nothing stops you from starting to engage, even if you're not fully ready yet and not all the admin and everything set up yet. That's fine. But the best thing to do is just to get in front of people and get in front of doctors. Discuss the opportunity, explain the model, get some feedback, see how you must tweak, how you engage, because that's where the learning's gonna come. Right? So we did a bunch of theory now. You've got a very different perspective, I'm sure. So yeah, so next week's training, Mikhail, there's no in-person sessions next week. Next week is purely practical for you guys to just go out. I'll send out a com on Monday to see if we do a Friday session, maybe just a morning, hour and a half, just to check in. And then the following week will be your clinicals. I think Joe has already sent out webinar links and times for the following week for the focus side of things. So I'll join on those sessions too. And yeah, that's where we are. Thank you very much, guys. Have a good weekend. Again, very proud of you all. It was really cool. This is like the start of a new era, I think, of doctors and healthcare workers. And you guys can be proud of what you're doing. So yeah. Lekker. All right.